My name is Ala Kamil, and I am serving as the designated federal official to the U.S. EPA Science Advisory Committee on Chemicals, which we call SACC. For this meeting and in my role, I will be opening the fifth and last day of the public meeting on the SACC's review of EPA's draft risk evaluations for dibutyl phthalate, DBP, dicyclohexyl phthalate, DCHP, and di-2-ethylhexyl phthalate, DEHP, and the technical support documents for butylbenzyl phthalate, BBP, and diisobutyl phthalate, DIBP, and the cross-phthalate human health benchmark dose, BMD, analysis, cancer analysis, and cumulative risk assessment technical support documents. I would like to repeat that SACC meetings are subject to all FACA requirements. These include open meetings, timely public notice of meetings, and document availability to the public. All documents are available to the public in the docket at regulations.gov. As a reminder, this meeting is being webcasted, transcribed, and recorded. A live stream of today's meeting is available on YouTube, and you can access the link from the meeting website, which is found in the agenda. So I would like to thank Dr. George Cobb and Dr. Robin Ann Gentry for facilitating the sessions in the past days. And also I would like to thank committee members and ad hoc reviewers and the public. Also, thanks are due to the EPA team. And now I would like to hand it over to Dr. George Cobb. Dr. Cobb.
Thank you, Dr. Kamel, and welcome to everyone. We have had a long meeting this week. We are actually right on schedule, though. So through all of the gyrations, we're almost exactly on schedule. So I'd like to thank everyone on the committee and everyone in front of the scenes from EPA and behind the scenes from EPA and the contractors for getting us this close to the finish line. We've had a lot of robust discussion, and just maybe a little bit of housekeeping before we take the roll. We're going to go through charge questions 19 and 20. 19 has several parts. And we're going to circle back to a couple of charge questions where there's some clarifications that have come during the discussions that we've had over the last couple of days. And then we'll determine if there are any final comments from any of the committee members. Or then if there are any clarifying questions from EPA along the way. So I'm not sure how quickly we'll get that done. I'm hoping it will be this morning, but we will see. So with that, I'm going to take the roll, and starting with Dr. Chason. You're on mute, Dr.
Here,
Chason.
thank you.
Okay. Dr. Ike?
Good morning, I'm here.
Dr. Font?
Good morning, I'm here. Thank you.
Thank you. Dr. Fox?
Yes, good morning.
Good morning. Dr. Gentry?
Good morning.
Dr. Graham?
Good morning.
Morning. Dr. Heiger-Bernays?
Good morning.
Hello.
Hi.
Ms. Jenkins?
Hello, good morning.
Good morning in Austin. Dr. Lee?
Hello, good morning.
Dr. Merced Nieves?
Good morning.
Dr. Ottinger?
Hi, everyone.
Dr. Sam?
Yes, good morning. I'm here.
Dr. Babbage?
I'm here. Good morning.
Dr. Chang?
Right here.
Right. Dr. David?
I'm here.
Thank you. Dr. Fanning?
Good morning, I'm here.
Glad you're here, way out on the West Coast.
Yeah, it's an early start, it's fine.
Dr. Martinez?
Hello, good morning.
Dr. Rowlands?
I'm here.
Excellent. Dr. Spade?
Here.
And Dr. Wolf?
Last and least.
Certainly not least. I guess somebody's got to be last. Okay. Thank you for getting through that with us. And now we can circle back to comments. And I don't want to have the readouts from the charge groups yet, but just general comments from the committee based on anything that we've talked about yesterday or anything that needs to be clarified from yesterday, but not those three charge questions that we just discussed.
Dr. Cobb, oh, sorry. For some reason, I couldn't find my raise hand thing.
Go ahead. You've got the floor. We'll get this Dr. Graham next.
Well, I appreciate that. Sorry. So I have some clarifying comments. I think they're mostly attached to charge question 11. So should I wait until?
If you don't mind.
Okay.
If you don't mind. Yeah. And maybe you can work with Chris on that as one unified thing. And now Dr. Graham.
Hello, everyone. This is Dr. Cynthia Graham. I read through the paper on the masks, and although they did find some phthalates and microplastics in the masks, they did find that the nasal lavages after mask use was lower than before mask use or without mask. So even though there are some phthalates in the masks, it looks like the masks are reducing the exposure. So I think I just wanted to bring that out. So that's, you really have to read through that article and how they did their different methods and their final conclusions.
Yeah, well, thank you. Thank you for that. That was not how I interpreted it, but I didn't have a chance to thoroughly read it, and I'm glad that you did. But that is definitely something for the writers of these charge questions to consider.
Right, and it is in their conclusions as well that the amount was lower in the after mask use.
Thank you. Dr. David.
Just a question for Dr. Graham, because I haven't read the article and we keep saying masks. What kind of mask, what material was used in the mask?
They had 4 different kind of masks, and they do describe them in the article. Most of them were surgical masks, but one was a different kind of, some kind of I don't know, mask but each department used all of them, and they did some studies in the various departments. But again, it was really interesting that even though they found the phthalates in the masks, and these are like surgical masks.
So I found another paper, a preceding paper by that group.
Okay.
That they classified several types that were N95s or other kinds of masks. So I'm not saying that's for the study you're mentioning, Dr. Graham, but they did characterize those as well.
Okay.
So I'm not disputing what you said, that most of those types in the document we discussed yesterday were surgical masks. That seemed to be what I read as well.
Right, and that's the NIARI, what's the 2024 is the one that I'm speaking of.
Yeah.
So that's the one I reviewed. I didn't see the other one. If you did send it along, I didn't look through that one.
I found it at 5 o'clock this morning.
And I haven't read that one. Okay, thank you.
Thank you for actually taking the time to go through that article in detail. Dr. Otten.
I didn't read it in super detail, but I did go through it and wanted to make 2 points. First, I agree with some of the cautions that my colleagues raised yesterday, but the other thing is that I was struck that quite a lot of the effect they were noticing was due to particulates, and that seems to be a pretty important part of the whole exposure there in that paper.
All right, thank you very much, Dr. Ottinger. Any other comments? All right, well, let's proceed then to get charge question 19A read into the record, please, by EPA. I don't know if that's Dr. Luz or someone else.
Hi there, good morning. Mark Meyer from the EPA here, reading charge question 19A. Thank you, Dr. Cobb. I'll proceed. As described in section 2.3.3 of the draft environmental release and occupational exposure assessment for DBP, EPA assessed releases of DBP to the environment using data reported to the EPA when available. However, when programmatic reporting data, such as toxic release inventory, TRI, discharge monitoring reporting, DMR, or national emissions inventory, NEI, were unavailable, EPA estimated releases using standard EPA models and equations, as described in section 2.3.4 of the draft environmental release and occupational exposure assessment for DBP. For some OES estimated using standard models and equations, environmental releases could not be attributed to a specific media type. As an example, releases from the manufacturing OES, or occupational exposure scenario, as discussed in section 3.1.3.2 of the draft environmental release and occupational exposure assessment for DBP, are categorized as being part of, quote, water, incineration, or landfill, end quote. In section 3.2.2 of the draft environmental release and occupational exposure assessment for DBP, EPA states that there is moderate confidence in the releases modeled for the manufacturing OES. Please comment on the strengths and uncertainties of using standard EPA models and equations for estimating releases in the absence of programmatic data and the confidence in these model estimates.
Thank you, Dr. Meyer. And now we can turn to our lead discussant for question 19, who has been very patient all week, Dr. Fong. Dr. Fong, you're on mute.
Good morning. Thank you very much, Dr. Cobb, and thank you for the opportunity to read into the record responses to charge questions 19A, B, and C, reflecting the really amazing and hard work of the committee. Let me start with question 19A, and how I plan to approach this is by starting with the issue identification and scientific rationale, and then finish up by covering summarizing the comments and the recommendations. So let's start with the issue identification. EPA estimated releases of DBP for the manufacturing occupational exposure scenario, OES, using standard EPA models and equations when programmatic data such as the toxic release inventory, TRI, discharge monitoring reports, DMR, or the national emissions inventory, NEI, were unavailable. And this was noted in section 2.3.4. In section 3.2.2, EPA states that it has moderate confidence in the release estimates for this OES. The modeled results include aggregate releases that are not attributed to specific environmental media, categorized instead as, quote, water, incineration, or landfill, end quote, section 3.1.3.2. This modeling approach raises concerns about how clearly the releases are assigned to specific environmental media, how accurate the model inputs are, and how useful the results are for assessing exposure and risk. These issues are relevant to DBP and potentially to other phthalates that rely on modeled data in the absence of empirical measurements. Now, let me go to the scientific rationale. Standard EPA models offer a consistent and transparent framework for estimating chemical releases when programmatic data are unavailable. For DBP, these models allow EPA to generate release estimates for the manufacturing OES using conservative assumptions, which supports a health protective screening level assessment. The use of default input parameters ensures that potential exposures are not underestimated. However, civil uncertainties limit the precision of these estimates. Key inputs such as production volume, control efficiencies, and waste management practices may not reflect actual facility conditions. In addition, modeled releases that cannot be attributed to a specific media reduce clarity for downstream exposure modeling. For DBP, this is particularly important because its physical chemical properties, for example, water solubility, log KOW, influence environmental fate. EPA's designation of moderate confidence is appropriate, reflecting sound methodology but limited media specificity and site representativeness. Now, let me go into summarizing the comments from the committee. One commenter noted that while the Monte Carlo method and use of importation volumes are generally appropriate, the assumption that significant evaporation occurs from quote, open exposed liquid surfaces, end quote, it's highly unrealistic for modern manufacturing practices. Most transfer operations are conducted through closed systems, such as metal tubing, which minimizes vapor release. Without specific data on the surface area of exposed liquid, this assumption may overestimate worker exposure. One commenter raised the concerns about how the EPA addressed it, missing data, particularly when no facility-specific or surrogate data were available. The document does not clarify what was done in such cases, and using 0 as a default value is not scientifically justified. This commenter also emphasized that the exclusion or lack of discussion of releases from municipal and hazardous waste landfills it's a significant data gap and must be addressed. One commenter acknowledged that the EPA use of OPPT models and Monte Carlo simulation is a reasonable approach given the scarcity of empirical data on production volume and operating days for DPP manufacturing. However, it is common to highlighted that only one of the 5 domestic manufacturers provided production volume data in the 2020 CDR. The agency then estimated production volume for the remaining sites using data from import facilities and the one reporting site. This comment also questioned EPA's assumption of 30 operating days per year without site-specific support and suggested contacting the reporting facility, in this case, DISTAR, LP, or relevant industry groups. Additionally, we pointed out that the EPA basically released assumptions on virtual tours of facilities that manufacture DIDP and DINP, not DBP, and recommended EPA provide justification for using these analogs. And now let me go to the recommendations. First, the recommendation is to improve media-specific attribution. Use literature, analog chemicals, or probabilistic methods to better assign modeled releases to to water, air, or land. Next, refine model inputs, update assumptions, for example, throughput controls, operating days, using more recent data from permits, CDR, or facility level information. Third, clarify uncertainty. Apply sensitivity or uncertainty analysis to better reflect the range of possible outcomes. Next, use available site-level data. Incorporate permit records or publicly available data to improve realism and confidence in the modeled estimates. Next, avoid unrealistic assumptions about emission sources. Re-evaluate assumptions such as open liquid surfaces were not supported by industrial practices. Next, address data gaps transparently. Avoid defaulting to zero when data are missing. Clearly explain how gaps are handled. Next, reassess analog facility use. Justify or revise the use of data from non-DBP manufacturing facilities if physical operations and emissions are meaningfully different. And finally, engage directly with reporting facilities. Contact known manufacturers such as DiStar LP to validate key assumptions like production volume and operating days. And that's what I have, Dr. Cobb. Thank you.
Excellent. Thank you for getting that into the record. Now we will turn to our associate discussants, and the first up is Dr. Graham.
I have no additional comments. Thank you.
Thank you. Dr. Semmel.
Yeah, yes, thank you very much. I also have no additional comments.
Thank you. Dr. David.
Oh, you caught me by surprise. Sorry. No, I have no additional comments. Thank you.
And Ms. Jenkins.
Only one small comment. I think Dr. Fong said that EPA assumed 30 operating days where they assumed 300 operating days. Just a minor thing, but I have no additional comments. Thank you.
Thank you, Dr. Jenkins. I had the same thought as I thought there was a different number than 30, so thank you for catching that. Now we can go to the rest of the committee to see if there are additional thoughts or comments about this or questions about this particular response. I don't see any, but I actually have one comment, Dr. Fong, and I don't know if this was your comment or you remember from the compilation. There was a mention of unrealistic assumptions, and maybe I don't remember how it was phrased. Try to minimize the use of unrealistic assumptions. Do you remember if those assumptions were considered to be unrealistically high or unrealistically low, or was it a mix? You're on mute again, Dr. Fong.
Yes, that was related to potential occupational exposure, and it was the uncertainty is it's overestimating potential exposure. So when it comes to how facilities or manufacturing sites handle chemicals during transfer or just use, especially during transfer, it's very seldom in an open vat of chemicals. It's usually done by, closed systems using metal tubes or other mechanisms of transferring. So it's not
Okay.
like somebody picks up a big container, opens it up, and then pours it into the machine where where a particular chemical is being used.
Yeah, I thank you for that. And that might be an important distinction to get into to clarify what that comment means, because it could mean a whole bunch of different things in that scenario. So I really appreciate your clarification. Dr. Heiger-Bernays has her hand.
Yes, thank you. And thank you for that summary. I only had a question, and that was with regard to a memorandum that came out on July 24th, 2025 from OCSPP with regard to the EHP occupational exposure on numbers of workers and ONUs. And it was not in the docket. It came out too late, but I didn't know if the discussants who reviewed this question had taken into account the information that was in this memo.
I have not seen it. Would you mind sharing that with us, with the members?
Dr. Cobb, is that okay?
Yeah, I think Dr. Kemmel has that document and can certainly share it with you.
It is already shared. It's in SharePoint, and it is available also in the docket for this peer review in the public doc.
Where in the SharePoint is it?
In SharePoint in the main page. It's not under any folder. It's under the peer review documents. The HP memo.
If it's helpful, I'm happy to share it. If not, if I can't, I mean.
It's already also in the public docket, so.
Okay.
This is Dr. Graham. Can you maybe, Dr. Heiger-Bernays, can you give us a summary of what was in there? Since we would, once we read it, we would like to get it into the comments, but something needs to be.
It's a very short memo, right? And it describes estimates for the number of potentially exposed workers. It's due to inhalation, that some measurements that were taken, and then provides information on actually some data, the inhalation monitoring data, and then the worker inhalation exposure estimates from the monitoring data, providing the central tendency and the high end. So why don't I just send it to you and then you'll have it.
No, that's great. I just wanted something on the record right now. So thank you.
Okay.
And Dr. Kemmel is correct. It is in the documents, and it's document number 111, and it starts OCSPP memo. So it's document 111 in the docket, in our documents section, and it is just under the documents tab. But it's near the bottom. It's not in a folder, so it's near the bottom. Thank you for getting that discussion started, Dr. Heiger-Bernays. And I had some thoughts on that particular document as well, that making sure that the OES numbers were right and the assumptions weren't overly, making sure they were considering enough workers. And I don't have the expertise to decide that, though. That's for these folks that are reviewing this charge question. Okay. Other comments from the committee or questions? Okay, now we can turn back to EPA to see if they have any clarifying questions.
Thanks, Dr. Cobb. Mark Meyer from EPA here. We don't have any clarifying questions. Thank you very much, Dr. Fong.
And thank you, Dr. Meyer. And then it's time to get charge question 19B into the record. Is that you again, Dr. Meyer?
That will be me. I'll now read charge question 19B. In section 3.3 of the draft risk evaluation for DBP, EPA estimates surface water concentrations for the manufacturing OES for its general population and environmental exposure assessment. EPA was unable to attribute a specific portion of the total release to just water. Therefore, for the screening level assessment for general population and environmental exposure, EPA conservatively assumed 100% of the release was attributed to water. Please comment on potential sources of existing information and approaches that may reduce the uncertainty of EPA's assessment of releases to multimedia categories when using standard models when programmatic reporting data, TRI, NEI, or DMR, are unavailable.
Thank you. Sorry, my Zoom is responding a little slowly today when I try to click myself back off of mute and audio silenced. So thank you for getting that into the record, Dr. Meyer. And then Dr. Fong, again, you are our lead to provide this summary.
Thank you, Dr. Cobb. I will be reading into the record the response to charge question 19B using the same format that I had used for charge question 19A, starting with issue identification, scientific rationale, and then finish up by summarizing comments from the committee and then also recommendations. Starting with the issue identification, in section 3.3 of the draft risk evaluation for DBP, EPA estimated that surface water concentrations for the manufacturing occupational exposure scenario, OES, by assuming that 100% of the total environmental release was directed to water. This assumption was made because the agency could not attribute specific portions of the modeled releases to water, incineration, or landfill. This approach likely overestimates exposure for the general population and the environment. The main concern is not that, the main concern is that not knowing how much of the chemical goes to water, air, or land makes it harder to estimate surface water concentrations accurately and weakens the confidence in the risk results. The scientific rationale, let me read that into the record right now. Standard EPA models offer a consistent and transparent framework for estimating chemical releases when programmatic data are unavailable. For DBP, these models allow EPA to generate release estimates for the manufacturing OES using conservative assumptions, which supports a health protective screening level assessment. The use of default input parameters ensures that potential exposures are not underestimated. EPA could reduce this uncertainty by using other available data sources. For example, rigor reports and NPDES permits may provide information on how DBP waste is managed at specific sites. Data from similar phthalates with more complete TRI reporting could offer useful comparisons. Input from industry or trade groups could also help clarify typical disclosure practices. These approaches would make the surface water estimate more reliable while supporting a protective assessment. Summarizing some of the comments. The first one is that there are likely very few sources of information on actual releases to water beyond predictive models and table 3-1 18. While DBP is classified as not, it's not as classified as, quote, not very soluble in water, end quote, by EPA. It is more soluble than higher molecular weight phthalates. Thus, the limited reported releases in Table 3-18 may largely remain in solution and should be considered in the exposure evaluation. Next, when emissions are reported in commingled categories and cannot be parsed by medium, EPA should assume that the total amount may be released to each relevant environmental medium. In this case, the greatest risk may arise from surface water exposure. EPA should therefore begin with TRI, DMR, and NEI data to inform the exposure assessment and require producers or users to provide data if they want more refined estimates. One commenter recommended including EPA's human health water quality criteria for DBP, which were updated in 2015, which includes the following specific information: 20 micrograms per liter for consumption of water and organisms, and 30 micrograms per liter for consumption of organisms only. These criteria are used by states in permitting and monitoring and could help identify state-level surface water waste monitoring data for DBP. One commenter highlighted inconsistency between Section 5.1 of the draft risk assessment, which states DBP has low bioaccumulation potential, and the 2015 water quality criteria, which identifies DBP as having high potential to bioaccumulate. EPA should address and clarify this discrepancy. One commenter agreed with the moderate weight of evidence rating for the release estimates from the manufacturing OES, Table 3-5, while noting that a slight confidence level could also be supported. Similarly, this commenter supported EPA's classification of slight confidence in the high-end surface water release estimates as an unlikely scenario, Table 3-7. One commenter suggested a clarification in Table 3-5 regarding DBP production volumes. It should state that only one facility reported production volume to the CDR, while 4 others did not. Let me now go to the recommendations. First recommendation is to leverage regulatory data sets, use RIGRA, NPDES, or other permit-based sources to better estimate how DBP waste is distributed across media. Second is engage with industry. Encourage voluntary submissions or stakeholder input to improve understanding of release practices where data gaps exist. Third is using probabilistic methods to estimate media distribution. When measured data are not available, applying information from published studies or expert engineering assumptions to estimate how releases are likely divided among water, air, and land. Fourth recommendation is include relevant criteria and monitoring data. Reference EPA's water quality criteria for DBP and explore state level permit or monitoring data to help validate or refine surface water concentration estimates. Next recommendation is address data aggregation conservatively. When releases cannot be allocated to specific media, consider evaluating total release for each relevant medium, particularly water, in the absence of better information. Next, clarify data inconsistencies. Ensure internal consistency between exposure assumptions and existing EPA documents, such as water quality criteria. And the last recommendation is improve transparency on reported data. Clearly state when and how production volume and release data were derived and inputted across facilities. Thank you, Dr. Cobb.
Thank you, Dr. Fong, for getting that into the record. That was a lot of information to get into the record. So let's now go to our associate discussants. And once again, we start with Dr. Graham.
I have no additional comments. Thank you.
Thank you, Dr. Semmel.
Thank you very much, Dr. Fong. No additional comments from me.
Dr. David.
Sorry, no additional comments. Thank you.
And Ms. Jenkins.
No additional comments. Thank you.
Excellent. So I just to go back to the next group, it's the rest of our committee. Does anyone have comments regarding this particular charge question? I do have one observation in listening through. There may be some of the recommendations that seem somewhat that aren't totally unified and maybe contrary. We may have to clean a little bit of that up in the final document. And I, having done exactly what you're doing now, and I understand that that's sometimes the nature of things in this particular setting. So I appreciate you getting all of that into the record. Now we can turn this back to Dr. Fong. Do you have anything else you'd like to add? No. Okay, EPA, do you have any, Dr. Meyer, any clarifying questions?
No clarifications from EPA. Thank you.
Well then, thank you. And let's then proceed to charge question 19C.
Before we do, would you like to ask the other members of the SACC if they have comments or?
I thought I did. I intended to have done so. Let's make sure that there are no comments from the rest of the committee. Yeah, I think I stumbled around on asking, but yes. Okay, so now we can get charge question 19C into the record.
Okay, great. Thank you, Dr. Cobb. Let me now
Well, wait, we got to get it read into the record, please, first.
All right. Thank you very much. Mark Meyer from EPA here, reading charge question 19C. In section 3.3.1.1 of the draft risk evaluation for DBP, EPA determined that there is slight confidence in the precision of the estimated surface water concentrations and subsequent risk associated with exposure to those concentrations for the manufacturing OES because of the combination of conservative assumptions of all releases going to surface water and pairing high-end modeled releases with lower flow receiving water bodies, P50. The SACC has previously commented on DIDP's risk evaluation, which paired high-end modeled releases with P50 flows that the EPA should revisit the modeling of DIDP concentrations of water and sediment by reconsidering the rates of environmental releases or the scale of the receiving environment in the modeling while maintaining conservatism in the assessment. EPA now estimates surface water concentrations based on multiple flows, P50, P75, and P90. EPA has moderate to robust confidence that the estimates using P50 flow values represent theoretical upper bounds of potential release concentrations appropriate for screening level assessments. Please comment on potential information sources and approaches to support use of a single flow value to refine the surface water concentration estimates.
Okay, thank you for getting that into the record. And now we turn again to Dr. Fong to get the response into the record.
Thank you, Dr. Cobb. And I will follow the same format of starting with issue identification, scientific rationale, summarizing commenters' responses, and finishing up with recommendations. As for issue identification, in section 3.3.1.1 of the draft risk evaluation for DBP, EPA states that it has slight confidence in the estimated surface water concentrations and associated risk assessments for the manufacturing occupational exposure scenario. This stems from two conservative assumptions. One, that all modeled releases are directed to surface water, and two, that high-end release estimates are paired with median P50 stream flow values. While protective, this approach may significantly overstate environmental concentrations and subsequent exposures. In response to earlier SACC feedback on DIDP, EPA expanded its modeling to include P50, P75, and P90 flows. The key question is whether a single stream flow percentile can be selected that maintains protective intent while better representing real-world environmental conditions. For the scientific rationale, EPA's decision to model multiple stream flows reflects a step towards more informative, scenario-based risk characterization. Using P50 provides a conservative upper bound, but pairing this with high-end emissions can amplify conservatism to the point of limiting utility. Surface water concentration estimates can be more meaningfully refined by accounting for site-specific discharge conditions and the scale of the receiving water body. Now, available data sets from USGS, for example, NWIS and NHD+, and NPDES permit systems can inform stream flow distribution near relevant outfalls. Where site-specific data are unavailable, regional stream orders or hydrologic context can guide appropriate percentage selection. A structured framework based on available discharge and hydrologic data can enable consistent yet context-sensitive flow assumptions. The key points raised by the commenters include: one commenter noted that prior SACC recommendations emphasized that evaluating larger receiving waters, not defaulting to a central tendency flow conditions. Use of 30 Q5 data for human health exposure, it's insufficiently protective. EPA's standard use of 7Q10 for aquatic life protection remains appropriate, and the P50 of 7Q10 conditions could serve as a more defensible benchmark. With increasing frequency of low flow conditions due to climate change, retrospective averages may not ensure future health protection. One commenter highlighted that table 3.4 presents implausible values, including identical central tendency and high-end release estimates across multiple uses, and one instance of a zero release for a paint coating category. These inconsistencies require correction. One commenter observed that while EPA refers to P50 to P90 percentile flows, the documentation for these values is difficult to locate and not adequately referenced in the draft risk evaluation. More transparent linkage to the methodology is needed. One commenter raised concerns about compound conservatism, especially when TRI-based release estimates, assumptions of no in-stream dilution, and application of high-end surface water concentrations from the manufacturing OES are generalized across other OESs. One commenter suggested a reasonableness check against EPA's human health water quality criteria for DBP of 20 micrograms per liter for water and organism consumption and 30 micrograms per liter for organism only. Modeled concentrations up to 885 microgram per liter, table 3.6, may be implausible, and it is unlikely such levels would go unregulated in practice. This comparison could help contextualize model outputs. Now, let me go to the recommendations. The first recommendation is to incorporate protective low flow metrics. Use 7Q10 or P50 of 7Q10 rather than 30Q5 as the default for surface water exposure estimates. Next recommendation is to correct non-standard values. Review and revise table 3-4 to address implausible or duplicated release estimates, including any zero values without justification. Next recommendation is clarify basis for flow assumptions. Ensure that the origin and rationale for P50 to P90 flow percentiles are clearly described within the main risk evaluation document. Next recommendation is contextualize model outputs. Compare modeled surface water concentrations to EPA water quality criteria to gauge plausibility and regulatory relevance. Next, it's avoid compound conservatism. Assess whether overlapping conservative assumptions, for example, worst case releases plus P50 flow plus no dilution, are justified in a screening level contexts. And the final recommendation is develop a flow percentile framework. Provide a tiered approach to flow percentile selection that considers site, sector, or region-specific information and maintains screening level protectiveness. And thank you very much, Dr. Cobb.
Excellent. Thank you, Dr. Fong. Let's see, now we go to our associate discussants, and Dr. Graham is up first again.
Thank you, Dr. Fong, for that summary. I have no additional comments.
Dr. Samuel?
Sorry, no additional comments. Thank you very much.
And Ms. Jenkins?
No additional comments. Thank you.
Excellent. Now let's go to the remainder of the committee to see if there are additional comments. Seeing none, we can go to EPA to determine if there are any clarifying questions.
Apologies for the delay there. This is Mark Meyer from EPA. No clarifying questions from us. Thank you.
Very nice, thank you. And then we can get charge question 20 read into the record so that we can then give our response.
This is Yashwin Mahid with US EPA, and I will read charge question number 20 into record. Within Section 3 of the draft Environmental Release and Occupational Exposure Assessments for DBP, DEHP, and DCHP, EPA has used the generic model for central tendency and high-end inhalation exposure to total and respirable particulates not otherwise regulated, PNOR, to estimate worker inhalation exposure to solid particulates for several occupational exposure scenarios, OES. The primary strength of this approach is the use of monitoring data from Occupational Safety and Health Administration, OSHA, Chemical Exposure Health Data, CEHD data. The primary limitation for this method is that OSHA CEHD dataset used in the PNOR model is not chemical specific, but instead specific to the NAICS code, which stands for North American Industry Classification System. Please suggest additional methods for estimating occupational inhalation exposures to solid particulates, which are more chemical specific. Thank you.
Thank you for getting that into the record. And now we can turn to our lead discussant, Dr. Samuel.
Thank you very much. So the comments of this group include, I'll read these into the record, based on review of EPA's generic model and its inputs, OES-specific monitoring or modeling to estimate worker inhalation exposure would be the best option. However, in order to have a chemical-specific exposure data or modeling result, one must do the work to have sufficient information or data on the chemical in question. During the process of preparing the draft risk evaluation, when EPA recognizes data gaps, the agency stakeholders should be approached to run these data collection studies prior to the draft being finalized in order to have appropriate data to evaluate risks. As the EPA has acknowledged in their charge question, OSHA's Chemical Exposure Health Data, or CEHD dataset or database, which was used by EPA as part of this approach, contains information from OSHA regarding airborne measurements collected at various workplaces during OSHA compliance officer visits during inspections over time. OSHA inspectors are often looking for exposure exceedances due to concerns or reports to the agency, and as a result, this database is unlikely to contain representative, average, or upper bound exposure measurements for routine activities across industries or occupations. Additionally, the data does not include any specific information, as noted, regarding individual industrial sites or other sites or production environments under evaluation, or the tasks that workers or others were performing, and only the broad industrial sector is identified. As a result, the relevance of these data to any particular OES or similar exposure group, or SEG, is typically unknown. It is not clear what sources and data exactly were included and excluded in the analysis using the PNOR, or particulates not otherwise regulated approach. The SACC committee has repeatedly commented on the need for EPA to consider all exposures to a given class of chemical that are related to industrial and commercial activities. Workers are likely to be exposed to phthalates from activities other than work, and those additive exposures should not be lost in an aggregate exposure assessment. As a result, the best method for estimating particulates exposure is to directly measure phthalate concentrations in particulate matter. With respect to this particular charge question, this would need to be done by the EPA or by the petitioners to have this review conducted. The other potential solution would be to ask each relevant facility to report data in a way that would allow for proper categorization by EPA. This would seem to be reasonable given the petition by manufacturers, to have EPA perform this review in advance of others that were previously in the assessment queue. Failing one of these two solutions, EPA seems required to assume the worst case or a very high percentile exposure, such as 90 to 95%, release and bioavailability scenarios to avoid establishing regulator guidelines that are not health protective. Inclusion of these high centile exposure estimates can only be avoided by inclusion of measured or robustly modeled data or other data that could be acquired that's chemical specific. As with the OES classification codes, if measured data are not available for modeling, then the other solution is that the sum of the particulate pollutants from the NAICS would be used for the assessment. It seems that is the direct result of stakeholders not providing adequate data for TSCA reviews or not being asked to provide these data. If these stakeholders did decline to provide the data, facilities claiming CBI should not be rewarded for failing to provide data for these risk evaluations. With respect to the SACC, EPA can attest that this committee has ample experience maintaining confidentiality of data that is submitted for review purposes. One solution could be assigning each facility a production volume of 5.25 million pounds per year. Then, if the three manufacturers who are claiming CBI release their production volumes, the reported volume ranges can be included in the PNOR models. It is appropriate for EPA to use data provided by the other two for modeling emissions from these facilities. The agency may also have overlooked the value of Hines et al. 2009, Gowden et al. 2008 and 2011, and also Dervin et al. 1993, in which urinary metabolites for several phthalate esters were measured from workers involved in several manufacturing and processing facilities. While airborne concentrations were not reported, the values could be used as a reality check for the estimates that EPA calculated. In addition, biomonitoring data are reportable under Section 8 of TSCA, 8E, and so there may be other non-published information available. The committee would also like to encourage the agency to consider mechanistic exposure models that are used in regulatory risk assessments, such as under REACH and the EU Occupational Health and Safety Directive. Examples of these include ART, or the Advanced REACH tool, and Stoffen Manager, which may better reflect the handling conditions, physical properties, and engineering controls relevant to phthalate use in each individual OES, and would also provide a distribution of possible exposure scenarios rather than just a point estimate. And finally, the approach outlined in Charge Question 20 appears to relate only to solid phthalates and not to semi-volatile phthalates. The EPA's inhalation exposure assessment should also properly consider the potential for vapor exposure to these semi-volatiles in addition to solids. And so the recommendation of this group is that during the process of preparing the draft risk evaluation, when EPA recognizes data gaps, the agency stakeholders should be approached to either run these studies or provide additional data to the draft being finalized in order to have appropriate and sufficient data and information to evaluate the risks.
Does that conclude your summary?
Oh, yes, I'm sorry. That is our comments. Thank you.
I tend to interrupt people, so I have to be very careful not
Oh,
to
no,
do
thank
that.
you.
Okay, our next discussant is Dr. Graham.
Thank you, Dr. Samuel, for jumping in and doing the summary for this charge question. I have no additional comments.
Great, and I thank you for reminding me, Dr. Graham, that Dr. Samuel picked this up midstream when someone had a medical situation that prevented it from doing this. So yes, thank you very much, Dr. Samuel.
Very happy to help. No problem.
Next is Dr. Fong.
No additional comments, but I want to again point out that Dr. Samuel did such an excellent job consolidating the responses from the committee. Excellent. Thank you.
Thank you very much, Dr. Fong.
Great, and then Ms. Jenkins.
No additional comments, and yeah, echoing a great job on that one. Thank you.
And of course, I'm the one who forgot to silence my phone. Thank you. Thank you, Ms. Jenkins, for that. Now, let's go to the rest of the committee and see if there are additional comments related to this question. I don't see any. EPA, do you have clarifying comments? Excuse me, clarifying questions.
Mark Meyer from EPA here. No clarifying questions. Thank you.
All right. Thanks everyone for getting us this far in the meeting. We are pretty much right on schedule. I think we should maybe take like a 10-minute break now, and then we'll come back and work through charge questions 11, 6B, and then parts of possibly 1 or 2. And then if we have anything else that we need to close up with, we can do that. Before we break, I'd like to turn it over to Dr. Kamal to see if there is anything administratively that we need to be paying attention to.
Everything is okay. So let's break for the 10 minutes and we'll meet after 10 minutes.
Yes, and Dr. Gentry will lead us after the break.
All right. Thanks for letting us know.
Okay, welcome back, everyone. Hope you had a good break. And I think we will get started now, circling back to some of the questions to get some clarifications or revisions to what has already been read into the record. And I think we're going to start with charge question 11A and B. And Dr. Chason, I think I'll turn it over to you for that.
Okay, thank you. Just 1 second. Sorry, I'm a little tardy getting back to my screen here.
No problem. I think my machine is moving slow as well.
Actually, we have one very brief sort of read in from me, and then we'll have our just 1 second. I can't pop in and pull this up at the same time. So with Dr. Fox, who will be making some comments too. Okay, very, very briefly, when we read this into the record, there may have been some, well, first of all, I apologize again. Some of the comments were a little scattered through the text. We wanted to make sure that 2 of the concepts that were sort of sprinkled through the document where it was clear that we were making clear recommendations, or I hope they're clear now, to EPA in this review. The first one was about how NHANES data are utilized, and we wanted to be sure that we were recommending that they will look at the information from multiple survey periods to give them some clues, if you will, about a couple of things. One was the types and amounts of the loads, if you will, of the different phthalate metabolites in the general population, but also across all of the subpopulation groups that the NHANES includes, not just the 2, just to take a look at what the trends may be. And the second one, taking a look at what are a more statistical approach to what the data suggests the parent compounds will be that they were exposed to. And so it's in the text. I'm just going to briefly read this. A recommendation is to leverage multiple cycles of NHANES data to get a better estimate of exposures over time on the population level within these equations. It's also recommended that EPA consider including the most recent NHANES cycle, assuming biomonitoring data from that cycle is available. If not, at least the earlier cycles should also be used. Within NHANES, multiple metabolites of DEHP and DINP were biomonitored. This includes metabolites also varying slightly across the cycles. It's recommended that EPA provide more information regarding which specific metabolites were included in the creation of the parent compounds, as well as more information regarding how parent compounds were calculated. Was this by molar sums, for example? So this, and the second is just a brief 2 sentences. Once again, combining some of the conversation from the document to make clear that the recommendation to EPA is as follows. That there is a significant expansion of the exposure scenarios is necessary. And in addition to the clear recommendation I read at the end, we're adding sort of the general concepts from earlier. This could include microplastics, recycled products, additional workplace concepts such as retail workers, maintenance worker exposure, perhaps healthcare workers, workers in other buildings or locations with potentially high phthalate levels. The SACC written report will discuss these scenarios and possible implications to pest declarations, along with other examples discussed during other charge questions. That's mine, so our associates may have additional ones, if you wouldn't mind calling on them too, please.
Okay. I don't know if Dr. Fox, do you want to speak first and then you can add to, I know you have a comment as well, and then I'll poll the rest of the associate discussants.
Okay, happy to do that. So Mary Fox here, and I just wanted to expand on one little thing. In the comments to charge question 11, I had asked for editorial clarification in the discussion that compares option 1 and option 2. And the terminology there was used was cumulative risk estimate. And I asked for clarification on that term. But beyond the editorial clarification, there's a risk concept here that I want to pull out for sure. And that is that margin of exposure, MOEs, are not risk estimates. And that's it. Thanks.
Okay. All right. Thank you. I will check with Dr. Ike. Do you have anything else to add to this response?
I do not. Thank you.
Okay. Dr. Lee.
I don't have anything to add.
Okay. Dr. Chason, did you? Oh, I see you went back on mute. Dr. Ching.
Nothing from me. Thank you.
Okay. Dr. Wolf.
Nothing more. Thanks.
Okay. Dr. David.
No additional comments. Thanks.
Okay. And Dr. Fanning.
Nothing to add to that. Thank you.
Okay. All right. I guess we allow, after hearing some of this, EPA, any clarifying questions?
This is Anthony Lowe's with EPA. We don't have any clarifying questions. Thank you.
Okay, thank you. I think now we will circle back to charge question 6. I'm not sure if we need clarification on both subpart A and B, but I will start with subpart B with Dr. David, and then I'll come back to Dr. Heiger-Bernays if she has anything to add. Okay, Dr. David?
Okay, thank you. So this is a bit of a refinement of our earlier comments from, I guess it was Tuesday. And just to emphasize that these comments are relative to the triad of the tumors that are related to activation of PPAR alpha. The SACC agreed with the sentiment of the classification, just as we had mentioned before. That is, that humans were not likely to develop any of these tumors from exposure to DEHP. But there was some concern about the wording that the EPA used. The SACC preferred a wording of not likely to be carcinogenic to humans for several reasons. First, activation of PPAR alpha elicits a series of cellular events that have been well characterized by Klonig et al. And Korten et al., and which are captured in the draft cancer human health assessment for DEHP, dibutyl, benzobutyl, diisobutyl, and DCHP as prepared by EPA. The initial events are measurable as enhanced enzymatic activity and a burst of cell proliferation. Continuation to cellular events occurs at higher dose levels, as demonstrated by the data from David et al., as illustrated by Klonig et al. In 2003. And thus it appears that the tumorigenic events are dose-dependent. Exposure of rats and mice to higher dose levels of DEHP than those which result in only enhanced biochemical or cellular activity are required for tumorigenesis. And we will illustrate that in our final comments. A panel of experts that was written up by Corton et al. In 2014 evaluated the evidence for concordance of key events in rats and humans, non-human primates or isolated human tissue. And they identified at least 2 key or associated events which were not observed in humans or human tissue exposed to DEHP. This suggests that humans are not likely to develop liver cancer using the framework review that was established by IPCS. In evaluating receptor-based events in animals and humans, a panel of experts from industry and government convened by the International Life Sciences Institute concluded that species differences in tissue density, the necessary activation exposure levels, and the efficacy of the receptor to trigger key events must be taken into consideration to assess risk. For PPAR alpha, there are data to show that the tissue density is almost 10 times lower in humans than in mice. The activation dose is nearly 10 times higher in humans than for mice. And the efficacy to trigger downstream events is either reduced or absent. The agency has acknowledged that exposure level results, a high exposure level results in the tumor triad. And by high, I'm using the typical rule of greater than 100 milligrams per kilogram per day in a rodent. So that higher levels, or pardon me, that humans might be exposed to normal conditions. So in other words, that level is much higher than we might expect humans to be exposed to. However, the wording suggests that cancer could occur if exposures were sufficiently high. And this actually represents some uncertainty for exposed populations without having the agency define what those exposure levels are. So the guidelines for carcinogen risk assessment from 2005 identifies 2 other classifications that could be applied. One is inadequate information to assess carcinogenic potential, and the other is not likely to be carcinogenic to humans. The inadequate classification is characterized by little or no pertinent data, which certainly is not the case here. Conflicting evidence, I'm not sure that the case is here, or negative evidence that's not sufficient to conclude not likely. On the other hand, the not likely classification is characterized by animal evidence that demonstrates a lack of carcinogenicity, convincing evidence that cancer occurs only in animals are not relevant to humans, convincing evidence that cancer is not likely to occur via a particular exposure route, or that cancer is not likely to occur below a defined dose range. It would seem that the not likely to be carcinogenic to humans classification is most appropriate, given, well, one, the agency's perspective on the likelihood of exposure sufficiently high enough to trigger a carcinogenic event, and two, that there certainly are data suggesting a lack of or diminished response in humans or human tissues exposed to DEHP. So the strengths and uncertainties, the SACC members certainly believe that the observation of a non-cancer no AEL or low AEL is lower than the lowest identified dose level for tumorigenesis in the liver, pancreas, and testis. And so that supports the use of non-cancer endpoints for the chronic and carcinogenicity risk assessment. The wording used suggests that cancer could occur if exposures were sufficiently high. This represents uncertainty. So we have some additional comments that were I mentioned in the first time around a few days ago concerning uterine tumors. I don't know if we need to add that to the record again. So I think that sums up our current comments. Thank you.
I think I'll just add my opinion. I think you're getting into the record that there may be concern for other tumor types. I'm not sure we have to specify, and that can be part of the written record when you write it up.
Yes, and I believe one of the other associate discussants wanted to bring that up.
And I will go to, let me just poll the other associates for this question. And then I will turn it over to Dr. Heiger-Bernays for part A. But related to this question, Dr. Wolf, do you have anything else to add?
I think Dr. David did an excellent job of herding lizards yesterday to get us to this document the way it is. I do want to say that it's going to be important that since 6B is dependent upon 6A, that the two of them reflect the total conversation and that 6A supports 6B. So in the write-up, we'll need to make sure while all these different things were discussed and are presented in 6B, we need to make sure 6A and 6B are coherent discussions.
Okay, thank you. Dr. Martinez?
Hi, I think Dr. David did a really good job in summarizing what our current thoughts are about the topic, and I don't have anything further to say at this time.
Okay.
Thank you.
Dr. Rowlands?
I'll be submitting some written comments later.
Okay. So I see some hands up. I know we need to get to 6A as well, but I'll open it up to the SACC around this one. I think after we hear from 6A, we can, open up for any other comments, questions around.
Actually, if I can just interrupt, I think you may have missed one of our associate discussants.
That
Dr.
would be
Heiger.
me. Dr. Heiger-Bernays is not an associate on this question, at least on my list.
Okay. She certainly has contributed to this.
Oh, yes. I think the group for A and B have worked together on all this. So I think she's the only one of the group that doesn't cross both questions. But I'll just open it up. Dr. Ottinger, did you have additional comments?
Yeah, I'm not part of the group, but I really appreciated the summary and just had one question, which is on the female side of the house. If endometriosis, which is very prevalent in non-human primates, but less so in humans, was part of the consideration with, the non-tumor specific kinds of responses?
Well, actually, the question that was posed by EPA was focused solely on the triad. So there certainly may be other tumor types that have been associated with exposure, and I leave that to the agency to tease out.
Perfect.
You know, if that's something that they need to address or not.
Okay, thank you very much.
Dr. Cobb?
And I am sure that Dr. Hager-Bernays was before me.
Okay, well, I will turn it over to her, and I don't know if you want to just address this question or if we want to move into 6A. Dr. Cobb, is your question related to 6B specifically?
Specifically to 6B, yes.
Okay, Dr. Hager-Bernays, do you want to comment on 6B?
Yes, I want to comment on 6B.
Okay, let's do that, and then I'll go to Dr. Cobb. Thank you.
Thank you. So there is epidemiological evidence of increased cancer risk in people, albeit associations between phthalate exposure, DEHP, and cancer risk that are inconsistent, and I provide citations. The tumor sites include breast and prostate, and also including citations. These tumor sites are tissues that are hormonally active. Based on what we know about DEHP and its ability to disrupt endocrine signaling through non-genotoxic mechanisms, there is not sufficient evidence, in my opinion, to conclude that DEHP is not likely to be carcinogenic in humans, but I recommend that the agency investigate the endocrine-related tumors outside of this review, and they were not recognizing that they were not part of this assessment.
Okay. Thank you. Dr. Cobb?
Oh, yes, I took my hand down by accident. So a couple of things. First of all, thanks to everybody for getting this very important question answered. I did have a question for Dr. David, and this is probably a minute question, but I want to make sure I understand because I'm not a physiologist. You mentioned tissue density. That is density of the receptor within the tissue or the actual density of the tissue?
No, it's the density of the receptor in the tissue.
Yeah, okay. Because there'll be some chemistry nerds like me reading this, maybe that could be part of the write-up. And sorry, I'm not trying to pick on you. I really wasn't my chemistry brain thinks of density probably in a different way than the biochemistry folks do. So thank you for clarifying that. I also did want to mention, Dr. Rowlands, if your comments have not been previously addressed in the meeting, we need to get them on the record, at least briefly, so that they can be part of the report, because things that have not been mentioned in the meeting can't actually be in the report. So they don't have to be verbose. And if you've said them before, we don't have to rehash them here, but I don't want you to lose that opportunity.
Yeah, I'll go ahead and read it out to you. It was mentioned. I talked about it in a fairly brief comment, but I'll put a little more meat on it with this comment, I think. So there was a public workshop that explored the dose response implications of toxicant modes of action mediated by nuclear receptors. This workshop looked at PPAR alpha, the H receptor, and CAR, and it was published in 2013 as a review article by Anderson et al. Now, traditionally, human health research has relied on linear extrapolation without a threshold for cancer. For non-cancer endpoints, and in some cases, cancer endpoints, subthreshold dose estimation has been employed. Advances in molecular toxicology and computational toxicology tools are now enabling more nuanced evaluations of receptor-mediated modes of action, including investigations into the existence or absence of subthreshold doses. Regarding PPAR alpha, exposures less than those that point to departure for any of the hypothesized key events would consequently protect against subsequent tumors in all species, including the human liver. So that's where it is.
Okay. All right, thank you. Dr. Fox.
Yes, thanks, Dr. Gentry. So I want to echo the concerns. I think, Dr. Ottinger, Dr. Hager-Bernays have made throughout the meeting and today. And just to echo the importance of recognizing evidence of cancer outcomes more broadly, even if it's not specific to the question that was asked for the review. These documents, serve as an important resource, right? Not just specific to the TSCA regulatory purpose. These synthesis documents are really important. And with the disinvestment that's been happening within the agency, these become even more important, right? Because I don't know if others who would normally be doing this are still going to be able to do this, at least in the coming few years. So just, echoing the importance of acknowledging the broader issues around potential cancer outcomes. Thank you.
Thank you. I think we've polled the associate discussants. I see Dr. Wolf's hand is up.
Yeah, I think just to take that a little further, Dr. Fox's comment, I think we have to remember that particularly within the cancer guidelines, site concordance between the rodent and the human is not necessary. So there's a lot of talk about liver carcinogenicity, but in fact, if you read the cancer guidelines, they specifically talk about if there's carcinogenicity response in the rodent model, you don't have to have site concordance. It's just the potential for carcinogenicity. So all these other potential tumors would be incorporated into the protection goals of the risk assessment. And I think that's an important component of this. So the goal of the carcinogenicity risk assessment is protecting from any carcinogenicity risk, not just liver tumors or the specific tumors identified in the discussion. Thanks.
Okay, thank you. Any other comments or questions from the SACC around 6B? EPA, any clarifying questions?
This is Anthony Luz with EPA. No clarifying questions at this time. Thank you.
Okay, thank you. And now I'll go back to Dr. Hager-Bernays. I think there's some clarifications or additions for 6A as well.
Correct. And apologies before I begin, because I think we are still in discussion in part. So let's take this and see where we are. I think that's the way to proceed. After discussion of 6B, we recognize the need for 6A and 6B to be aligned because they are closely connected. There was a great deal of discussion with some of the discussants with regard to the concept of threshold. And the focus of this question was, I want to go back to the charge, right? So we're on track here. Please comment on the strength and uncertainties of EPA's preliminary conclusion that the tumor triad in rats is related to PPAR activation following chronic exposure to DEHP. That statement, there is concurrence, and I read this before, with that statement that the tumor triad in rats is related to PPAR alpha activation following chronic exposure to DEHP. So I want to get can I get a confirmation from the others that this is in fact, this piece of this, we are in concurrence with the decision with the strengths and uncertainties of EPA's preliminary conclusion?
I see.
All right, we have Dr.
Wolf.
Wolf.
How about Dr. David?
Yeah, I agree. Yep.
Okay, I want to make sure, I just want to go through this so that we identify the places where we're still in discussion and the places where we can move on.
Okay, let's check with Dr. Martinez.
I agree with what you just said, so I completely concur.
Okay, and Dr. Rowlands.
I'm fine.
Okay, so it sounds like you have agreement within the group for that first statement of the charge question.
Right. Now we had an additional member, who is Dr. Babbage. He's not officially listed as an associate, but he was participating in all of our discussions.
Okay,
so,
Dr. Babbage, would you like to weigh in as well? And we can open it up to, if you want to, the whole SACC. But Dr. Babbage, do you agree with that statement?
Oh, well, yes, and yes, I agree.
Okay. So let's keep going.
Okay.
So we get to and that is in concurrence. So we're good with that statement for 6A as it relates to 6B as well. Okay, second part. Now here we're asked to, in your response, please include discussion of strengths and uncertainties of available data supporting key events in the PPAR alpha mode of action and the scientific rationale for a threshold approach for cancer dose response assessment. So there are two pieces to that I'd like to separate, at least for now, because that's where we had our discussions. One is the scientific rationale for a threshold in this PPAR alpha mode of action for DEHP. Dr. Gentry, I got this right? Okay. So this is where we had discussion with regard to whether there is or is not a threshold. And since we presented this 2 days ago, additional comments have been provided that from, how do I say this, from a minority perspective in the group, that perhaps there is not a threshold, and I'm just gonna say that there is not a threshold, and Dr. Babbage provides evidence for his statement. And Dr. Babbage, I don't want to get this wrong. I want to make sure that is what you are saying, is that you do not, the scientific evidence does not support a threshold for this PPAR mode of action.
Well, or at least that I don't, EPA says that there's a threshold because their phthalates are non-genotoxic. And I want to say that that's not sufficient to support of the existence of a threshold. And I don't see any just genotoxicity. I don't see any justification for a threshold.
Okay, so there is no, in your statements, there is no justification for a threshold based solely on the genotoxicity data?
Well, yes, but I don't see any, beyond that, I don't see any other justification to assume a threshold.
Okay. So that is where we have two differing opinions. And the citations are included for Dr. Babbage's statements. What I'd like to do now, though, is open it up to the two others. Dr. Gentry, if that's okay.
Well, I see Dr. David and Dr. Wolf both have their hands up. So,
and those are the people I'd like to bring into the discussion.
Okay. Let's start with Dr. David.
Okay, so this is, I guess, we are hampered by the use of the word threshold and what that means. So one of the things that Dr. Babbage pointed out is that in the chronic study of DEHP, the one that was published by David et al. It shows that there are cell proliferation events and biochemical changes that occur at a dose level at which there are no tumors. And so one has to deal with that. And yet, at higher dose levels, there are tumors. So something happens as the dose increases. And I'm not sure there's a good understanding of what those changes might be to result in a tumor when obviously we had some other events that are certainly associated with activation of PPAR alpha, but no tumors. And so in our document in 6B, we took out the word threshold and used a dose-dependent transition. Now, for many people, that typically means that there is something that happens for the change in outcome. That I'm assuming that that's the case, but I don't know what it is. But it seemed a better term than threshold. And so is it any better to use dose-dependent transition or something that identifies that activation alone by itself is insufficient to produce the tumor? And I think that's what you have to kind of deal with.
Okay. Thank you. Dr. Wolf.
So I think we have to separate out the different components here. So there are, as one would expect, biological responses to exposure to phthalates. And as mentioned before, since rodents can't vomit, the only way they can get rid of a ingested contaminant is to metabolize it away. So you would expect them to have a rapid response to something they ate and consumed, and even at very low concentrations, that's the only way they have to get rid of it out of their bloodstream. So you would expect then at low doses to have some sort of response. So it does make sense some of these responses might be linear. The same thing for some of the lipid metabolism, which happens across multiple organelles in the cytoplasm. That's different than the biological processes or key events that are necessary for mode of action. In a mode of action, you have to start with the end. You have a collection of adverse outcomes, and then you go back up to the key events that lead to that. And so those are two separate activities. And so in the particular question here is there a dose transition, a point of departure that you wouldn't see tumors, so below the dose, and that's what you see with the tumor response. Now, there may be other responses that happen, but with the tumor response, there is dose transitions. And even with the palmitoyl-CoA, as I pointed out the other day, there are, with DEHP, at the low dose of 30 milligrams per kilogram in rats and 20 milligrams per kilogram per day in mice, there's no increased palmitoyl-CoA activity. And so, so there are things that happen at different doses you would expect, and that's why that comment that Dr. Rowlands made about the dose transition, Dr. David just made about dose transition so important, because lots of other biology can occur at these transition points. And collectively, you put them all together to describe a mode of action.
Okay, thank you. Dr. Babbage?
Yeah, so I just wanted to say that the reason I want to keep the word threshold in there in my comments is first because EPA used it, but also because a dose transition or a threshold is a dose transition, but a dose transition is not necessarily a threshold. It could just be a change in the dose response, or as in a change in the rate limiting step. And the other point I just want to emphasize is you can't really prove whether there's a threshold or not, because we don't really know what's going on at the very low doses. So I'm not saying, I mean, I don't think there's a threshold, but there could be. I'm just saying that EPA doesn't have enough justification not to assume a linear dose response.
Okay, thank you.
Okay, so we have now, I guess we call it a majority point of view and a minority point of view.
Mm-hmm.
And the next part is a direct extension of the difference in perspective on threshold or dose transition, because it asks for whether this approach is suitable for cancer dose response assessment. So that goes from what do we observe in the science to whether we use that threshold approach for assessment of cancer for DEHP. So I think by extension, there were two perspectives. One is there is a threshold or a dose transition that is relevant to the liver carcinogenesis through the PPAR alpha mechanism, and that what EPA has done and is proposing to do is to use a threshold-based cancer dose response assessment, which would identify the dose that is higher than the point of departure for the non-cancer risk, although we were not asked about non-cancer specifically. So it's my understanding, and as we had commented prior, that the assumption or the justification for a threshold is justification for a threshold based or a nonlinear dose response assessment for carcinogenesis. And we have the two perspectives, one, which is threshold and associated nonlinear dose response for cancer, and the other is insufficient evidence for threshold and a retention, I guess, of the linear dose response approach for cancer assessment. And I had added, and I had provided this in the docket, but it was read for 6B, which is that, get it here so that it's in, that that the non-cancer, both the non-cancer point of departure approach and the threshold-based, which is a point of departure approach for cancer, assumes that there are events that do not occur below the point of departure or threshold. And this is important. And I'll cite the National Academy from 2009 and others, Bessinger, McParland, Nielsen, Woodruff, WHO, and other international organizations that recommend the harmonization of approaches, cancer and non-cancer, adopt a non-threshold approach and not vice versa, that using harmonized non-threshold approach also, and this may or may not be relevant, makes decision-making easier for risk managers. Maybe I won't add that, but I'll just say that using a harmonized non-threshold approach is consistent with the recognition that there are biological events that are occurring below the points of departure. And there are members of this 6A that disagree with this, and I'd like to get their voices on record. So when I draft this, I have the right information.
Okay. I think I'll just add one comment. I'm
Yep.
not on this group, but I'm on the 6B. I think as we finish our comments, I think there's we need to look closely at EPA's cancer guidelines and what drives these classifications and how anything quantitative rolls out from that, because I think if we are in agreement on non-likely or inadequate, there are certain conclusions regarding the quantitative assessment. I think also concern about, the threshold limit. I mean, if we shift to the non-cancer POD, which is what they're asking to do, we are picking the most sensitive endpoint and point of departure from that approach. So I'm not saying we remove any concerns or minority opinions, but I think some of that needs to be folded into our comments.
Point well taken. Thank you.
And I'll open it up to any other SACC members that have comments around this.
Okay, I'll jump in.
Okay.
So, so several things. One is, as we discussed earlier, there might be biological responses occurring in a linear manner, but what we're specifically talking here is a threshold for carcinogenicity risk, not any effect. And that the idea here is that for the unification of cancer, non-cancer approach, that the most sensitive endpoint, which in this case was thought to be the testosterone alteration, would protect against everything else downstream. So either that's protective or it's not protective. That's the thing. The NAS 2009 Science and Decisions referenced here argued for default before data. You go do the default. That's what they said in there. The agency reviewed that. Full disclosure, I was on the Risk Assessment Forum Committee led by Ed Ohanian that discussed this for quite some time. And the decision was the agency had it right from the beginning. It's data before default. And so if you look at the collection of data, do we have sufficient data to address this? If you go back to the cancer guidelines, they specifically address this. So for the mutagenic mode of action, by policy, this is a policy decision, risk characterization will be based on the linear model. Also, by policy, when there is insufficient data to describe a mode of action, then the risk characterization should be by the linear model. Only in the case when there's sufficient data to describe a mode of action, and it is based on a non-mutagenic mode of action with quantifiable events, then a traditional reference dose or reference concentration approach can be used for the risk characterization. And that's what the agency is trying to do here, is to say, using the reference dose for protecting against this hormone change. Again, this is based on a lot of data, plus the uncertainty factors, taking it down to a fairly low point of departure as is appropriate and precautionary. That can be used to protect for any consequence, including chronic toxicity and carcinogenicity. And so that's the goal. So yes, things can occur at low dose, but what we're talking about here is, are we protecting from chronic toxicity and carcinogenicity? And I would argue, my personal opinion is yes, the approach they're using does do that.
Okay, thank you.
Okay, any other comments, questions? Okay, EPA, do you have any clarifying questions related to 6A or 6B?
This is Anthony Lowe's with EPA. First, I'd just like to thank the committee and all the discussants for the really excellent discussion here of thresholds and dose response transitions. It's really fascinating. It's been really interesting to hear. I think from the discussion, I was able to pick up where there were consensus opinions and where there were majority or minority opinions. But it would be really helpful in your report, when there are differing opinions, just to really be clear and document which are majority opinions and which are minority opinions. That would really help us. And I think that's all I have. Thank you.
Okay, thank you.
Thank you.
Thank you. All right. I think with that, we can move on to, I think, Dr. Ottinger, you want to circle back to charge question 2?
That would be much appreciated. I just have a couple of clarifying comments, and of course, if EPA or any of the discussants have anything additional, that would be very helpful. So reading it in, some additional comments would be, consider that there could be qualitative or quantitative phthalate syndrome in birds and other wildlife as a way to group the constellation of responses that have been observed. The next comment is the role of metabolites could be significant as a potential issue for both domestic species and wildlife exposures. And then the third comment is control data from domestic species can inform the wildlife studies, especially those that reveal physical or gross abnormalities. And with that, I would ask if the discussants or the SACC committee would have any other questions or clarifying comments, or the EPA. And also acknowledging that we have a list of the requests from the EPA to make sure that we have that in our write-up.
Okay. I'll go to your associate discussants first. Dr. Spade.
No, I appreciate you mentioning those additional items that we discussed, Dr. Ottinger, but I don't have any further comments.
Okay. Dr. Fanning?
Yeah, like Dr. Spade, thanks for bringing it up. And I hope to put some attention onto the discussion of these items in the next week, and nothing to add at this time. Thank you.
Thank you.
Okay. Any other comments, questions from the SACC? Dr. Cobb?
Really quick, and I don't know if this came up in more detail in our comments, but I do remember writing some comments around the transformation product question that Dr. Ottinger brought up, is that the monoalkyl phthalates are, if they are transforming in the environment as quickly as the document indicates and data indicate, then there's very large exposures to these things, and the relative potency of these monoalkyls for any of the toxicity endpoints that we are talking about could be really important. And you can harken back to PCB or dioxin kind of days. Not that they're equally toxic, but that you can get different potencies from transformation products or from differing structures. So that's all I wanted to say.
And just to follow up on that, these are lipophilic, so they're going to be concentrated through maternal deposition into the yolk of eggs in wild birds, and if exposure occurs in domestic species, in domestic poultry as well, in the eggs.
Okay. Anybody else from the SACC? Okay. EPA, do you have any clarifying questions?
This is Mark Meyer from EPA. No clarifying questions. Thank you for the additional discussion.
Thanks.
Okay, thank you. And Dr. Ottinger, do we have to revisit charge question 3 or not?
No, I don't think so. I think we have everything we need for that. Dr. Cobb, was there anything that you wanted to add to the record for that?
I do not think so, but thank you for asking.
Yeah, I think we're in good shape. And just I have a minor comment for charge question 4 when we get to that, if that would be possible.
I think we're there.
Okay.
I think.
All right. The added comment that I wanted to make was that there are additional references for molecular mechanisms involved in the response of aquatic species, and that includes work by Denslow and others. There's notably a paper by Miller et al. 2007 that links vitellogenin in minnows as a biomarker of potential population level effects on fertility and productivity. So that among some of these other references will be, I'll write up that and add that into our draft for consideration for the lead and the other discussants and members of the SACC.
Okay. I'll go to your co-discussants. I think Dr. Spade was the lead on that question. Do you have anything to add?
Yeah, no, that's correct. And I just want to say thanks again for making sure that got to the record.
Okay. All right. And Dr. Fanning?
Nothing to add.
All right. Anybody else from the SACC? Okay, seeing no hands raised, I'll see if EPA has any clarifying questions.
Mark Meyer from EPA. No clarifying questions. Thank you for those additional references. We'll look forward to reviewing them.
Okay. Well, I think unless there's some other question or clarification, I'm going to turn it back over to Dr. Cobb to wrap up the day for us.
So thank you, Dr. Gentry. And I do want to, I think we did this, but I want to double check that everybody has had a chance on the committee to comment on any trailing issues that we have not gotten to during this meeting. And Dr. Gentry, thank you for leading us. I just want to double check. I tend to step over the top of people when I'm not supposed to. Dr. Fox.
Hi, thanks. So I did have one quick issue that relates to charge question 5H. And I made some comments there related to Bayesian model averaging and whether that utility was available in EPA's current version of their benchmark dose software. And I looked this morning, and that utility is available for dichotomous dose response models. So I don't think it helps us for the phthalate case, but I just wanted to clarify that.
Thank you, Dr. Fox. So other comments? I actually have one and maybe one and a half. Yesterday, I don't know, 5 o'clock Eastern, I located another reference that's germane to the charge question 16 and others related to charge question 16. I have not sent it to anyone because the closest I can get to a hard copy of the document is through Hero, and I get led to a Hero reference, and we don't have access to that particular Hero reference, or at least I couldn't get it when I was trying to. The document is called Migration of Plasticizers to Nonylphenol. Migration of plasticizers and nonylphenol from polyvinyl chloride gloves. And this was for disposables and non-disposable gloves. Hero ID 1325730 for those in the EPA. It's a study out of Japan, as best I can tell. I'm just going to read something really quick out of the abstract, and the abstract is all I have. PVC gloves released 0.005 to 0.416 micrograms per square centimeter of DEHP, DINP, DEHA into water in 20% ethanol or 4% acetic acid. And it goes on to give other indications. I cannot tell whether this information, I cannot tell if this information is done at higher temperature or not, but the conclusion is PVC contacts with fatty food could release these compounds into the foods. So depending on the way these gloves are constructed, that's a two-way street. It could go also into the hands that are in the gloves, but I haven't had a chance to review this. Again, I can't get to it in the docket. So, and I see Dr. David's hand is up.
Did you mention what the citation was or the year this was published?
The year is 2000.
Okay.
And it's by Kawamura, Kawamura.
So I think I found it, and it's in Japanese. So all you'll have is the abstract, unless I guess you can put it through a large language model and have it translated.
Well, I was trying to get that downloaded today, and I couldn't get into Hero because
it
was trying to talk to me. Yeah, it was trying to talk to me while this call was going on, so I couldn't do that. Dr. Fanning.
I believe, and I don't have it up in front of me, but there are multiple papers reporting presence of phthalates in different kinds of gloves. So there's the food service gloves, there's also medical gloves. PVC is less commonly used in these kinds of gloves at this point in time, but I'm quite sure there are some publications that if we have time to pursue this particular article, that could be found. So I know I did a light review of this in some research I conducted several years back, and may have additional references, but I'm not going to be able to cite them into the record at this time.
That is absolutely not necessary. The topic and is all that we have to have, and some dialogue around this is good. And I apologize for not having any more information than this. This is, I had asked possibly to get this into the, shared with the committee, but it was very late in the day. Dr. David.
Yeah, I think Dr. Fanning is correct. This is not the only reference, and I may have some of those available. So, I mean, I guess you only need one to demonstrate that it could happen. But I know that there have been a number of studies that have looked at transfer of plasticizer from PVC gloves that are often used in food preparation, or whether in the kitchen or actually preparing food prior to packaging.
Excellent. And thank you for that comment. I'll get to you in just a second, Dr. Kamal. I did want to say that having one reference is, a start, but if we had a good assemblage of references that we could offer to EPA in our final report about this is kind of the data that we see out there. And maybe a quick conclusion about what we see from that. And I can't tell you what I see from it because as I said, I've just got this one abstract. Dr. Kamal.
I just wanted to give you more information about the reference that you mentioned that is in HERO. So we all have the same access to HERO, but when I checked it for you, it is in Japanese, as Dr. Wolf mentioned, and it's only an abstract is submitted in English. But the article itself is in Japanese, and the full text article is not available in HERO. So it's not that we don't have access. No, it's not available over there. But of course, more digging, we may be able to find it.
That's actually really good information, Dr. Kamal, and I appreciate that. And I'm not suggesting that I or anyone on the committee read that article, but and it seems like there's lots of other references, so we can get to the essence of this question, perhaps, in our writing. Dr. David.
Just to follow up on Dr. Kamal's comment, I have experience having looked at these kinds of articles, and you're right, the text is in Japanese, but thankfully the numbers are not. So you can always go to the tables and get a sense of what are the data indeed. So
Dr. Cobb, I found the article and I sent it to you. So the full text with all the tables is there. And I think, again, you can usually use one of these large language models and get it reasonably, that's what in my experience, reasonably translated. But as Dr. David said, yeah, all the tables are in English.
So thank you. Our library did not have direct access to these journals, this particular journal. Okay. Any additional comments from the committee? EPA, do you have any questions about the information that we just discussed? I'm not seeing any questions, so I'm going to take that as a no. There's Dr. Luz.
Apologies for being slow to get my camera turned on. Yeah, I don't think we have any clarifying questions. Thanks, though.
Excellent. Excellent. Thank you. And I'd like to thank the whole EPA team for keeping the information flowing into the record and for having dialogue with us about this very important topic. I think at this point it is time to adjourn, and I will turn this back over to our designated federal official, Dr. Kamal, to make sure that we have completed all of our FACA requirements.
We did, certainly. So this was a great meeting. And I personally enjoyed all the discussions over here. But in closing, I'd like to thank everyone who contributed to this meeting. And first, I would like to thank the peer review and ethics branch in EPA who prepared for this meeting. And you see on the slide, the team of the peer review and ethics branch on the left-hand side. I also wanted to thank all the other branches and divisions in EPA who also contributed in making this happen, especially the regulatory support branch and the communication branch, as well as the budget and planning branch and the EPA dockets, the OCSPP dockets. The staff did a marvelous job in uploading all these documents into the docket in a minimal amount of time. And also I wanted to thank the contractor, Endina, Mr. Ali, and the meeting contractor, William King. Thank you very much for all your helps. And you may remove the slides. And then I want to thank you, Dr. Cobb, and I want to thank you, Dr. Gentry, for leading the meeting and going through all the agenda items for following all FACA requirements. Also, what's more important also is to thank the SACC members and the ad hoc reviewers for all the discussions, for their input and participating in this meeting. I want to also thank the OPP team for the humongous effort that they have done in preparing for this risk evaluation and for presenting the risk evaluation, the draft risk evaluation and the technical support documents, and also for responding to the committee questions. And lastly, I want to thank the public for listening and for presenting their oral comments. So I'm asking if the committee members would stay after we adjourn the meeting. We will have a short administrative session, and that would be the end of the meeting. And now the meeting is adjourned. Thank you very much.